Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis Scott with What's Happening in Birmingham. I am back with part two with Dr. Jamie Bell. We're talking about diabetes, and this segment, I hope you all are still walking.
Yes.
If you're watching part one, or some of you might do part two and do part one, but just nevertheless, just be walking while you're watching this interview. You'll thank us later. So in part one, we talked about the different types of diabetes, the signs and symptoms, and the complications.
Absolutely.
Part two, we want to talk about treatment, prevention, and also a little myths.
Okay.
So once you're diagnosed, what's the next steps?
Once you're diagnosed, the first thing that I like to do, along with starting medication, is sending somebody to a nutritionist, a diabetes educator. You will be started on medication more than likely. Also, but medication is important, but behavior is also equally as important, because you need to, first of all, understand what diabetes is. And that entails, number one, checking your blood sugar, knowing how to check your blood sugar at home, which is a finger prick, which is not painful. And you need to also know what to eat, because at the end of the day, we can give you as many medicines as possible, but if your diet hasn't improved, your diabetes will not improve. Right. So food is powerful. And like we said before, it's all about sugar. It's all about carbohydrates. So you need to be able to know what foods you need to eat, because carbohydrates are important, proteins, fats, your water intake is important, and exercise is important. All right. So they come to me after I diagnose them. We're getting them in with the diabetes education. We're starting medical management as well.
All right, so before I go back to the food, so what the new drugs that people are trying now to treat diabetes?
For diabetes, what are we kind of using? Well, first of all, like we said, most of the people that I'm seeing at this point are going to more than likely be type 2 diabetics. Like we said, type 1s typically, historically, are younger. They're kids, they're adolescents, so their pediatrician more than likely has diagnosed them. I'm seeing type 2 diabetics. Type 2s, their body makes insulin, they're insulin resistant, their body doesn't know what to do with the insulin that they make. So we typically start them out with pills. We don't necessarily go straight to insulin in most cases. But the pills I like metformin. It's a medicine that's old, it's been around for a long time. I like a group of medicines called the sulfonylureas. That can be glipizide or glimepiride, some of those medicines. We got a slew. We got probably 7, 8, 9, 10 categories of oral medicines that we can try. But people don't want to be stuck. People don't want to be on the needle.
Yeah, because I think most times people fear diabetes, like, oh man, I'm going to have to take that needle and all that. Right. Okay.
So we can start with medicines based on that patient's presentation and their lab results. We start them on medicines. Like I said, the medicine's goal is to try to train their bodies to use the insulin that they're still making. Remember, they're insulin resistant. Their body doesn't know what to do with the insulin that it has. So we're trying to use the pills to help train their body to use the insulin that it still has. And along with diet and exercise and healthy lifestyle modifications, we can obtain control. But it also goes back to the patient. I tell them all the time, I can take you to the water, but I can't make you drink. You've got to do the hard work, but I'll walk that road with you. So.
All right, so let's get to the foods. Well, let me go back. What are some side effects some of your patients said from some of the drugs typically?
Some of the drugs? Okay. Well, when you're putting people on medications, you've got to continue to monitor certain things. When you're taking medicines for diabetes, like we said before, what happens is you eat food, your blood sugar goes up. So we're giving you these medicines because the pancreas isn't working that well. So we're using these medicines to bring your blood sugar down. So you've got to eat with these medicines. You can't take these medicines on an empty stomach, because we're dealing with diabetes, we're dealing with insulin, everything goes back to sugar intake. So so you take them with food. If you don't take it with food, your blood sugar will drop. If a blood sugar drops too low, that can be just as dangerous as a blood sugar that's extremely high. So, and then people can get lightheaded. They can pass out if their blood sugar gets too low. The kidneys are so important. Certain medications, we've got to be monitoring those kidneys, which we'll be monitoring them anyway, because we don't want you to have complications of diabetes, because the diabetes can cause kidney problems. So some of those things. So certain medicines you can't use if people have certain other diagnoses, but your doctor will be able to adjust the treatment to fit you.
Okay, and another thing I was thinking while you were saying that was, can you kind of stress to people about skipping,
Skipping meals.
No, skipping meals.
Oh.
Skipping taking a shot.
That's bad. Okay, the other thing is when people get to insulin, and insulin is not really a bad thing. Like I said, nobody wants to give themselves a shot, but insulin isn't a bad thing because if we can't control you with pills, we have to go to insulin. Many times the pancreas will burn out, and people who are doing well with pills may eventually get to the point to where the pills don't work anymore. That can be because their blood sugar is in control. So lots of people who are type 2 end up on insulin. And I tell patients all the time, if your sugar isn't controlled, I can't give you enough insulin until I get it controlled. So that's another thing. That's the way the body works. When you eat, your pancreas, a normal pancreas, secretes insulin to bring your blood sugar down. So you take your insulin with food. Excuse me. You take your insulin, your medication with food to bring it down. One of the insulins that I really like, and I don't work for any pharmaceutical company. I'm not obligated to any pharmaceutical company. This is Dr. Bell's preference. I really like Lantus and I like Levemir.
Okay.
And they have generic forms of them, so they're more affordable. But I like those because you take it one time a day. Typically, people take it at night after dinner or right before bedtime, and it gives you a steady state of insulin versus where some medicines you get peaks and valleys where people can go too high and drop too low. This tries to mimic a normal body's insulin or normal body blood sugar state to where you don't get a lot of peaks and valleys. So I like those medicines. They're typically once a day. Sometimes people have to take insulin with food, but I have a lot of people who are just on that insulin and don't have to take a mealtime insulin with it, so to speak. So.
Okay, so let's get to the food.
The food.
What food should people eat? What should they avoid? To me, just Googling, I saw people stay away from pasta.
You think they can't eat nothing?
Stay away from
you can't
pasta.
eat anything.
Like, I got a list of meals I'm going to talk about in a moment, but just what specific foods? I know fruits, vegetables, but...
People have got to learn, and this can sound like overwhelming for people. That's why my diabetic educator is important, because people have got to learn how to count carbohydrates. And if you're diabetic, you need to know how to count your carbohydrates, how many servings, this type of thing. But a general rule of thumb that I like to tell people is that it all goes back to sugar. You want to avoid things that are high in sugar. And one good thing is avoid white colored foods.
Okay.
White rice, white potatoes, white bread, white pasta. I'm sorry. Yeah. I will never tell a patient that you can never have a piece of cake. You can never eat pasta. You can do things, you just have to do it in moderation and do it in what's appropriate. It's not realistic to tell people they can never have it. You can't have it every day. You may not even be able to have it every week. But if you work with someone and you can figure out a regimen that's good and be balanced for you, you need to be eating 3 times a day: breakfast, lunch, dinner, a healthy mid-morning, a healthy mid-afternoon snack. That's important. You cannot skip meals. That's just not good anyway, because when you skip meals, your metabolism goes down. I hear people all the time say, I can't lose weight, and I'm not eating that much. I'm only eating 1 time a day. Well, that's why you can't lose weight, because your body goes into starvation. It doesn't know the next time it's going to be fed, so you don't burn your calories. So 3 times a day, 2 snacks. Avoid, obviously, things high in sugar.
What about people say fruits? And a lot of people say, well, I don't want to eat a lot of fruits, but I want to do the fruit juices.
Juices are bad. And that's a good thing for people to know for their kids. Parents are like, well, I don't give my kids soda, I give them juice. Well, juice is just as bad. Juice is 100% sugar. Juice can be problematic. How about water? Okay. What happened to water?
Okay.
Like, water is good for you. I think me and you briefly talked about like alcohol and stuff. Certain alcohols are higher in sugar. And then what people do is they put a chaser with it. They put soda or juice with it, which increases the calories. I know that there's some beers though that are like lower in carbs and lower in sugar. So it's just about reading your labels and knowing what things you can and can't have type thing.
Well, let's talk about red meat. Can they have red meat?
They can have red meat, but that's protein. But still with that, you want to limit the amount of red meat you maybe have. You know what I mean? You're not going to eat red meat every day.
Okay.
Yeah.
And I'm going to look in the camera and say, processed foods.
Processed foods. They can be high in sodium too. Okay. A lot of that, which is not good for you as well. A lot of processed foods are high in sodium. It goes back to reading those packages, because things that we think are in food and things that you probably think that are good for you are not necessarily good for you.
Like the microwave meals?
Yeah, and things that people think that are like bad for them may not be that bad. Like, let me tell you this. Like, And there are alternatives. Now, food has gotten so sophisticated. You can do so many things and still get the same flavor of food without it being that bad food. Like, you may not be able to eat a white potato all the time, but you can eat a sweet potato. Those are actually pretty good for you. They have different types of pasta that aren't carbs. They got gluten-free pasta. They got healthy options with a lot of things now.
So you pretty much covered all my myths. Pretty much special diet. But one I think we left off was, this special. How many drinks can someone have?
What do you mean? Alcoholic drink?
Yeah, while they, diabetes. I know we kind of going back to what we was doing back earlier, but how many drinks?
Well, then you got to think about being intoxicated.
Okay.
So you got to know about that, because we don't want anybody getting on the road and driving intoxicated and hurting themselves or anybody else. But I can't remember that rule of thumb that they say, because I think like a man can maybe drink 2 drinks every couple hours, but a woman can only drink 1 drink. Don't quote me on that. I am not sure about that. But you still want to limit alcohol, because we don't want people to engage in bad behaviors that are going to put them or somebody else at risk. But I can't say that you can never have a drink. But I don't encourage anybody to drink on a daily basis.
What do you see when you go in the grocery store and you see the labels? I made sure I wrote this down. So diabetes friendly and sugar free. Are those typically?
I would look. It's sugar free if it has a 0 next to
Okay.
that sugar, because
Okay.
you're gonna see carbohydrates and you
Okay.
see sugar.
Okay.
So you've got to be very cautious. And a lot of these mixed drinks have a lot of sugar in them too. When you think about it, a lot of the margarita stuff and all that have a lot of sugar in it. So you've got to be very cautious, because alcohol, you can get a lot of empty calories. You can get a lot of. Nothing's good going to come out of those calories for you.
All right, and last but not least, exercise. Like, how important,
It's critical.
and what do you suggest for people?
Well, I'm not going. I think you have to find people where they are and then make their regimen equivalent to where they are, so to speak. I'm not going to tell everybody that you need to get out and you need to run a mile today. No, that's not realistic. I think with people, if you could start with, hey, maybe they can walk 15 minutes, maybe 3 or 4 times a week. And I think what happens is they'll start to do that. They'll see a few results, and then they'll say, okay, well, maybe I'm going to walk 30 minutes 5 times a week. And as their endurance gets better, as they see results physically in their body, as their friends start to notice and say, hey, you looking good, then it encourages people to do more. They feel better about themselves. Their energy is up. They'll do more. I think the problem is that we have very sedentary lifestyles. We're not very active. I think this time of year, when it's warm outside and it's not cold, we need to take advantage of that. Like if you can start out and you're sedentary, I think if you walk 15 to 20 minutes, maybe 3 or 4 times a week, I think that's great. I think if you can do 30 minutes of physical exercise, whether that's a brisk walk 5 times a week, I think you're winning. If you are somebody who cannot get up at all, I have seen people sit in chairs and do chair exercises, whether that is, and you don't have to have weights. You can get the canned foods and use that, move your legs, move your arms. That at least you're doing something. You're getting the heart rate going and you're improving your health overall.
All right, so I like how you said about walking. As a matter of fact, if you're walking right now, you're taking the first step.
Taking the first step.
Taking the first step. So what else would you like to, because as you all know, she's very passionate about this subject. You want people to know about, diabetes, how to prevent this. And, like I see a lot of times, it's really based on what you eat.
It is very much based on what you eat.
And I guess if you could just share that as a final thought more than anything,
right.
Right. The importance.
Because there's no magic pill for it. But at the end of the day, it's about how you take care of your body, what you put into your body. Food is very powerful. We didn't see people with certain diseases like this 30, 40 years ago. We didn't have all these people with type 2 diabetes. We had type 1 diabetics. But type 2 diabetes, we're seeing more people with that because we have an epidemic where people are eating more fast food, where people have busy lifestyles. And I get it. You know what I mean? I work full time. I'm a full-time mom. It's hard. We work all day. We take care of our families. But it is critical that we create healthy lifestyles for ourselves and our kids, because what we do, we pass it down, and then we can end up having generational curses, which we don't want. So I want to encourage everybody to eat healthy. Parents, you are in charge of what you put into your kids' bodies. They don't buy those groceries. So what you buy is actually what they're going to eat. So if you want them to be healthy, you need to be buying nutritious things. I understand that healthy food can be expensive, but sometimes we have to make the sacrifices. I tell patients it's either pay me now or pay me later. Either you're going to buy the healthy foods and you're going to have good health and you're going to eat healthy, or you're going to be paying on the other end with prescription medicines, doctor's visits, and copays. Take charge of your health, y'all. You got one body, and it's the only place you have to live.
And I hate to add, this is another thing I thought about. Potatoes.
We talked about potatoes.
We talked about potatoes.
White
Okay.
potatoes. Eat a sweet potato.
Okay, that's it. I told y'all I wanted to make sure I won't leave no stone unturned. Well, Jamie, thank you again.
Thank you for having me. It's always a pleasure.
Yes, good friend of mine. And I guess bring you back again. We're going to talk about
See y'all next time. We'll talk about something else exciting.
Another fun topic. And thank you all for watching. And for more information, please check out my website, what'shappeningbirmingham.com. And don't forget to subscribe to my YouTube channel to see more videos. Thank you all again. Bye-bye.
Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website or subscribe to our YouTube channel for the latest videos today.